Bill O'Reilly spoke about the new Obamacare court decision that came out yesterday, and he proved, yet again, he has no clue what Obamacare actually is.
The pinheads in Congress passed Obamacare and didn't know what was in it. Even President Obama didn't know what was in the bill. But the overriding issue here is not the minutia of Obamacare. It is the use of taxpayer dollars. Obamacare is a pure income redistribution play. That means President Obama and the Democratic Party want to put as much money into the hands of the poor and less affluent as they can. And health care subsidies are a great way to do just that. And of course, the funds for those subsidies are taken from businesses and affluent Americans who have the cash. Income redistribution is a hallmark of socialism, and we in America are now moving in that direction.
We're already there, Slappy. Does he not understand what Medicare is? Does he not understand what Medicaid is? Does he not get what the police department is, and the fire department is, and the roads, and the bridges, and the infrastructure, and the FDA, which makes sure that when your sorry ass eats chicken, you don't get salmonella, or when you eat a Kobe burger, you don't get E. coli? Do you have any idea that all these things are, socialist, mean socialist institutions? Every single modern industrial nation is a hybrid. We are a hybrid of capitalism and socialism. And of course, the capitalism is regulated capitalism. Any government activity can be defined as socialism, okay? So this idea that like, oh my God, this nation is moving towards socialism, we've been there for quite a while, son. Every modern nation has been there for quite a while, and you wouldn't want to live in a nation that didn't have any socialism at all. So it's perpetually amazing to me that somebody who really doesn't know anything about political science, terms and definitions and different forms of economics and government, he doesn't know anything about that stuff, but he's had a show for how many years? And just every day he goes out there with arrogance and over-the-top confidence and just spews things in a way that tricks his dumb audience. See, that's the thing that's so scary about a guy like Bill O'Reilly. He can shamelessly not know something, but as long as he says it strongly enough and assertive enough, people go, oh, that Bill's quite an expert, let me tell you. What a straight shooter he is, man. Did you see the fucking title on the screen as he's talking there? Obamacare and socialism. Obamacare is not socialism, dippity. I wish it was, because every other modern industrial nation has essentially a socialist healthcare system, a single-payer healthcare system, where it is genuine redistribution of wealth, where your tax dollars fund the entire healthcare system. That would be France, that would be Britain, that would be Sweden, that would be Norway, that would be Canada, that would be Australia, the list goes on. And guess what? All of their healthcare systems rank better than ours! Ours is ranked number 37. I wish we had socialist healthcare. Absolutely. Not just because it's my opinion, but because the data and the facts show that those are better systems, empirically, taking opinion out of it, just going by the numbers. Okay? So the guy, he simply doesn't know what he's talking about. And see, this is the thing. Obama does what the Republicans want him to do, and then they attack him anyway. You know, if they're going to attack you anyway, why not just do the right thing, and why not just do the progressive thing? But he doesn't. The real liberal/socialist idea is single-payer healthcare. Then the compromise is public option. We didn't even get that. Then from there, you go all the way over to the individual mandate, which is, of course, what Obamacare is. And when you look at who came up with it originally, Richard frickin' Nixon came up with the idea originally. Then in the 1990s, the Heritage Foundation wrote policy papers about it, saying that's what they're in favor of. They're a right-wing think tank. And the reason why they're in favor of it is because Clinton Care, which was being debated at the time, oh, that's the liberal option. We're in favor of the conservative option, the individual mandate, which means we keep the insurance companies intact and we mandate that people have to buy from the private insurance companies, the capitalist for-profit insurance companies. So Obama does the pro-establishment, pro-capitalist reform, and they still attack him. And I love the irony of Bill O'Reilly saying, well, Congress, they didn't know about Obamacare. They didn't read about it. President Obama, he didn't know what's in the bill. He didn't read about it. As he's saying that, he's showing that he doesn't know what's in the bill and he didn't read about it. What a sad, sad man. They focus on the few tiny parts that could maybe loosely be considered income redistribution, right? In terms of Medicaid expansion, which isn't even what he's talking about here, by the way, which again shows how silly he is. And just the idea of subsidies. The idea that the federal government is going to do subsidies to help middle-class taxpayers pay for their health insurance. He frames that as if it's pure income redistribution, but it's really not. Again, because we're dealing with private health insurance companies, number one. And number two, these people are not only paying taxes, okay, they're also paying premiums to their health insurance companies. So they're not getting a free ride, okay? They're just, instead of having to pay, like I would have to pay $600 or so if it wasn't for Obamacare, now I pay less. Now a little bit gets off that. But it's not like I'm mooching. The subsidy isn't just purely, oh, we're going to help you out and just give you this money so you could be like a parasite or a moocher and just exploit the system. That's not true at all. And by the way, we are still paying more than other modern nations are, and they get better care. So, again, he totally misunderstands it. It's sad he has no understanding of the basic political and economic definitions and the different kinds of healthcare systems that exist. It's just confident ignorance that dupes over other ignorant people.